Movement is your dog's language. Learning to understand it changes everything. Welcome to Inside the Canine Athlete with Jana and Dr. Sherman Canapp.
In episode 1, we talked about why toes matter so much for the canine athlete. We looked at what digits do during movement and surface interaction. We also talked about why not every toe problem is the same and why appearance alone really does not tell us enough. And today we are going one layer deeper. So we are going to talk about the diagnostics, the treatment decisions, rehab progressions, also return to sport. And this is where the conversation becomes really, really important, because a dog may really look fine walking around the house, but that does not automatically mean that the toe is ready for the athletic performance. So, Sherman, if episode 1 was all about helping handlers notice digit problems, what do you feel that we are all really going to dig deeper into today?
Yeah, so it all starts with the toes. That's where they meet the ground, and it's a chain, and it works the whole way up. And we dug very, very deep in episode 1, looking at anatomy and what owners should be looking at and handlers. We'll pick up a little bit from there and move on, because the whole premise of this is so that we don't have to ever go through what we're going to be talking about in this episode, which is there is an injury and how in the world are we going to identify it, treat it, and then get back to sport, which is what it's all about. So, but for those out there that may have a dog that has a digit injury, or you're concerned that there may be, or you're trying to prevent one, this episode's for you. So, so that's what we're going to do a deep dive into. We're going to go digging into this episode of all things digits, which I think is one of the most important episodes we have, because it's a chain. It starts here, and without grip or with too much grip, we have to remember there can be too much grip, okay, because that actually can cause a problem as well. So yeah, let's dig in.
All right, before we repeat a little bit about the anatomy, just a little reflection. Like, I think many handlers and trainers have experienced this. The dog is not obviously lame. The toe does not look dramatic, or the problem like comes and goes. So it can be really easy to miss. So why, in your experience, can digit injuries be so hard to diagnose?
Yeah, I think they're hard to diagnose for a few reasons. First off is that the dogs that we're all working with, they're so high drive. They're so high drive. When they just sprain a digit or have a strain to a little flexor tendon, they're not going to tell us. You know, they're not going to, the toe could fall off and they're still going to want to work, right? So it's very, very challenging, because they have to get to the point where either A, you're noticing something in the field or in the ring, or B, during your body assessment, when we're body mapping, we notice something. And so because they can't talk to us, and because they're going to look really, really good out there for a long period of time before structurally something is really breaking down, we have to really identify what's normal. Okay, so I can't reiterate that enough, that we can't know what's abnormal until we know what's normal. So this is why identifying normal anatomy in your dog, when we're talking about digits, the front and the rear, is so important, so that you might not see it in the ring, but at the end of the day, you're like, whoa, there's some sensitivity here. Whoa, there's some wear to this pad here, where the range of motion here feels a little tighter than I noticed in the past. Because they're not going to show you something's up. You have to identify it for them, because they can't talk to us and they're sure not going to show us. I think that's why it's so challenging. And they don't show lameness. It has to be a really high grade, and we'll get into grades here in a minute, but it has to be a really high grade, acute injury or chronic injury before you're going to say, wait a minute, I'm seeing something out there, or before you're actually going to start to see them have a little bit of lameness. Most of the dogs you and I see, they're not coming in holding up the paw. They're not coming in with a head bob lameness. We're not seeing those. We're seeing very, very, very little subtle changes. And you, as the owner or the handler, may notice something and go into your healthcare provider for your canine athlete, and they look at your dog and they watch it walk and trot and move, and they feel things. They're like, your dog's fine. Your dog's fine. And then you're like, no, it's not. No, it's not. I'm seeing this, this, and this. And so trust your gut if you think something's going on. It's all about early intervention. And so that's why I think also here it's important in this episode, because we're going to talk about what early intervention really means as far as diagnostics, and then trying to prevent this from moving further into a higher grade or to an actual injury.
Yeah, I think it all comes down to the assessment. So If we suspect a digit issue, what should actually happen during an assessment? Like when you examine a toe, what are the things that you're looking for?
Yeah. So we're going to start at the nail. Nails are so important, and they're so underrated. They use their nails. They use their nails to grip, for acceleration, and that's why also nail wear can be important. We don't want the nails too short. We don't want them too long, because then actually mechanically they can cause what we call a lever arm. So it can actually stress the digits if the nails are too long. So it has to be almost like a medium length for most sports and most dogs. But if we see abnormal nail wear, if all of a sudden one of the nails is being worn more than the other, is there something going on? We get to the actual digits. Think of our fingers. For those of you not watching, but you're listening, if you think about your own hand and where your nail is, we actually have these little digits. We call them P1, 2, and 3. Do we notice any sensitivity on range of motion? Is there any swelling over that area? Was the dog periodically looking at a particular toe? Or, did you notice that they're paying a little bit more attention to that? So very little subtle things that you would notice at home and that we as practitioners would notice. So we're doing our full digit assessment. That's going to be putting things through range of motion, just palpating each joint, feeling almost, I'll call it a wiggle, right? We're going to wiggle each one of these little joint spaces, P1, 2, and 3, not crank on it. These are very sensitive little things that you're doing, very micro movements, to see if anything's abnormal, but it's abnormal because you already palpated or felt normal. So those are the things that we're looking for: heat, swelling, sensitivity, response from them. Okay, these dogs will not talk to us. So I'm going to be looking at it. So I'm taking that digit. We'll call this, this is going to be, for anatomy wise, our thumb is 1, and then 2, 3, 4, 5. So if I'm taking one of the digits and I'm just gently moving it back and forth, wiggling it inside and outside, did they hold their breath? Did they look at me? Did their pupils dilate? Did they check in? Did they all of a sudden try to pull the paw back? Does it have a little bit of sensitivity there that you can actually feel things happening? A little more motion. These are all those things. There's like 7 things that I look for in that performance dog, because they're so high drive. I have to look at them and see how they're responding just when I'm at each one of those locations, because it's subtle little things, and they're not going to talk to us, and they're surely not going to show us anything, out there in the field.
How about like the extra information for everyone who is listening? Maybe some material that they can get prepared. Like, what kind of information would make your job easier? Like, should they bring the videos? Should they know about what activity triggers a sign? Tell me.
Oh, so I cannot emphasize enough pictures and videos. And what's incredible is that clients will come in, patients, they'll say, "Can I show you this video?" I'm like, absolutely. In fact, I ask them to send me the pictures and the videos in advance so I can prepare. But pictures and videos are so important. And what I want for starters is just have your dog sitting and get a picture of each paw. Have them standing, get a picture of each paw from the front, from the side, from behind. Because if they start to have, we call it a carpal hyperextension, where they're starting to break down some of these structures, they may drop a few degrees. Okay, well, if you have a picture of them standing, you're going to see that anatomy. Okay, the digits you can palpate. You could just set up your phone on an some sort of mount, and hit record, and just go through range of motion so you can see their response and how things feel normal. So I think what can help me so many times is normal picture anatomy, so that when you come in now and this one digit looks a little swollen, I see what was normal for your dog, so I can compare it to what seems now abnormal. So I'm all about data, and getting pictures and videos is so important, and documenting, hey, it's normal until we come out of the ring and we do this sport, and then I'm seeing this particular area swelling. The way you'll know it's swollen is because you knew when it wasn't swollen, because you mapped out what was normal. So data for me is so important.
Right. And before we go on with the diagnostics and imaging and stuff like that, would you like to reflect once again on the brief anatomy?
Yeah, I mean, anatomy 101, we have to understand anatomy, and our anatomy is very similar to theirs. We have fingernails and we have digits and fingers, and it's a very similar thing. It's just we don't walk on our hands. They do. But yeah, our anatomy is fairly similar, so we can easily go through some anatomy. I don't know if you want to show a slide. Here we go. Okay, so for those of you that are listening but not watching, what we're showing is dog basic anatomy of their, what we call it in veterinary medicine, distal extremity. And all that really means is down the leg towards the toes. And so we have, if you think of your fingernail or their nails, that's associated actually with a little bone structure there as well. And we call these P1, 2, and 3. So that would be down at what we call P3. There's 5 digits. Our thumb actually counts. And think of their dew claw. Their dew claw counts and it works and it's important. And it actually grips and has a function. Imagine if we didn't have our thumbs. Okay. So they actually use theirs. So that would be 1, 2, 3, 4, 5. 5 is the one that's on the outside. Okay. Interestingly, in the JAMA publication that came out in 2018, what they looked at there was what was the most common digit that was injured. It was number 5. It was the guy on the outside. So if we're going to spend time really, really evaluating our dog's toes, I don't want you to give love to all of them, but boy, oh boy, pay special attention to number 5. That's the one on the outside, because in that publication, which was the largest publication of agility dogs looking at digits, number 5 was the guy. Okay. So I want you to definitely pay attention to that. But these are going to be the 1, 2, 3, 4, 5. We have our different, we'll call it the joints of our fingers, P1, 2, and 3. And then we get up to where our hand would be. That's called metacarpals for us. And then the little bones in our wrist, those are called the carpal bones that allow the wrist to kind of flex up and down, back and forth. And you do have some medial and lateral, we call it, reaching to the outside or the inside. Those are collateral ligaments. So each one of these little joints, we just think of that one little knuckle for us. Believe it or not, that knuckle has ligaments on each side, the inside and the outside. There's a joint capsule. That joint capsule keeps the fluid in there that lubricates that joint. Wait a minute. Yep. There's cartilage on the inside of each one of these little knuckles and each one of these little joints, because they're actually a joint. And then we get deeper under the hood. Okay. We're going to do a deeper dive, and there's all these soft tissues. We're playing piano. That's our flexor tendons. We're extending our fingers. That's our extensor tendons. And there's all these structures that are almost like we call it a retinaculum, but they're like a little structure that holds those tendons, soft tissues together. So when you have a digit injury, we have to say, is it actually the ligament? Is it the joint capsule? Is it the soft tissues around it? And then we think about the pad. Those pads are super important for grip, for cushion. And between the bones and the pad, there's a soft tissue structure as well. It's actually made up of fat, believe it or not. And that allows you to grip. It acts as a cushion as you're coming down from jumps. If you're out there in rough terrain, think about the pads working against rocks and roots and different structures. So boy, oh boy, oh boy, is there a lot to each one of these little digits. There's a ton. And I need you to be aware of those things, feel them, palpate, manipulate, pictures, videos. And as a clinician, I have to look at each one of those little structures and identify, if this dog's sensitive on one particular area, which of those doggone structures did we actually tweak to cause that swelling? So it's a lot under the hood that we need to dig into to be able to say, what did we do and how are we going to get back?
Absolutely. And definitely the next layer, diagnostics, continuing with the diagnostics. So once we have that exam and we have that history, the next question is often imaging. And I think this is where many owners get confused, because sometimes the x-rays are normal, but the dog still has a problem. Like, what is it with that x-ray that it can show or not show something?
Yeah. So the first thing I need everybody to be aware of, including all those that are out there that are veterinarians or veterinary rehab therapists or professionals, that the most important diagnostic tool we have out there is not an MRI. It's not a CT scan. It's not an X-ray. It's not an ultrasound. It's our hands. Okay. It's our hands. And we have 2 of them, and they're free. And this allows us to really dig in and palpate and look for those little subtle things that we can't see on an X-ray or some of these other technologies. So for us, we always start with our hands, most important diagnostic tool. Then the next thing we will do is an X-ray. And we do an X-ray to be complete. And one thing I would say for any of you that are veterinarians out there, please always X-ray both paws. Okay, so do both all the way down to the digits. Many times X-rays, I see these and they cut off the paws. They give me the wrist, or we call the carpus, all the way up the front leg. And I'm like, wait a minute, you cut off the nails. I need to see those little guys. So please, those of you that are out there, X-ray both so we can compare left to right. We may see something on this one little digit. Oh no, that's normal. It's there, identical on the other side. And then 2 different views. Okay, we do the front view, we do the side view. But if we're worried about a sprain, we may do what's called something that's a stress view. We may put a little bit of stress on that particular digit to see if the space opens up a little bit more than it should. So that's called a stress view. So there is a lot that we can gain from an x-ray if there's a fracture, if there's arthritis, if there's something where a piece of bone got ripped off, or if it's chronic in nature, we'll see calcification or mineralization. We can see that on x-ray. But unfortunately, the majority of the time, the x-rays are completely normal. Okay, so just because you have a normal x-ray does not mean that there is not a lot going on, because most of these are soft tissue in nature, especially the collateral ligaments. We know these digits are the most common thing that get injured. They're going at speed, they're turning, they're gripping, and it's the inside or outside of those digits that take a lot of load biomechanically. And we're not going to see that on an x-ray, but we can on some other types of diagnostic tools.
All right, but I'm going to bring up one image of an X-ray for those of you who are watching. Clearly, there are some things that can be seen, right?
Absolutely. So for those of you that are listening but not watching, what we have here is an x-ray of a set of digits. It's a carpus or a paw. And what we're seeing is, remember, our thumb is number 1. So this is number 2 digit. And where you're going to see the red arrow, we're showing an arrow here, and it's going to an area where there's a fragment. Okay, I call the word fragment. What that really means is a piece of bone. Now, that can be one of a couple things. It can be that there was such a chronic sprain to the collateral ligament, okay, and that would be the medial collateral that we're looking at here, that it actually calcified or mineralized. So the body's trying to heal things all the time if there's an injury. And unfortunately, the only way it can really heal it is by scar tissue, which isn't great because it limits range of motion, or by laying down bone. So when we look at this, we say, okay, is that little piece of bone that we see there, is that chronically calcified soft tissue, or actually a fracture, or what we call an avulsion? And I'll explain an avulsion. So you're in a boat and your boat is tied to the dock, and you forget to untie. Not that I've ever done this before with my own boat, but you go and you pull away, and one of a couple things is going to happen to that line. Either the line's going to snap in half, okay, or where it's tied to the bone is going to pull off a part of the boat, or it's going to pull off a part of the dock. Well, if it pulls off a part of the boat or the dock, that's actually cause what we call an avulsion, okay, or an avulsion fracture. And that's what you're seeing here in this x-ray, is there's a big chunk of bone that's sort of floating in outer space. Well, what we don't realize attached to this big fragment that we can see is the soft tissues. There's a collateral ligament there. And if it's strong enough of an injury to pull a piece of bone off, you can imagine what that soft tissue must look like. But unfortunately, all we can see here in an x-ray is the bone. We have no idea what status the soft tissues are. We can see a lot of soft tissue swelling here around that area where you see the arrow. But we say, boy, oh boy, what grade is that soft tissue? And is this stable? Is it not stable? Because that's going to help us identify what in the world do we do for rehab, and how are we going to get this dog back to sport?
Okay, but I believe when we are talking about soft tissue lesions, then diagnostic musculoskeletal ultrasound can come in handy, right?
Yeah, absolutely. So the next thing we would do is we'd say, okay, if it was you or I, our kids or our dog, what would we do from diagnostics? So we started with palpation, most important diagnostic tool. We took an x-ray to be complete. Is there arthritis? Is there a fracture? Is there an avulsion? We now know what that is. A luxation, where the joints just not together. You know, one portion of the thumb is this way, another portion is that way. But then the next thing is, okay, it's soft tissue. And with soft tissue, you could do an MRI, you could do a CT scan, or we could do an MSK ultrasound. The reason we like ultrasound, it doesn't require anesthesia. Okay, we can do these things awake. We can look at very, very subtle little changes. And under a CT scan or MRI, the dog's under anesthesia or sedation. So we can't look at things, what we call dynamically. They're static. So that digit is just laying there. We don't see it going through range of motion, where with an ultrasound, we can stress it, we can move it, we can put it through range of motion and see how are those soft tissues actually gliding, guiding. Is there some breakdown? What's the fibers actually doing? So my go-to for pretty much most soft tissue injuries, whether it's a digit all the way up to the shoulder, is going to be an MSK ultrasound. And the nice thing is with that, we can ultrasound both front legs, right? So we can look at the digits at that one area on the outside of that one digit and compare it to the opposite to say, is this normal or is this abnormal? And then we can stress it, put it through range of motion. So without a doubt, MSK ultrasound has really been a game changer when it comes to sports medicine and our canine athletes. It's been there forever in horses. It's been there forever in human athletics. Finally, and I'd say in the last 10 years or so, it's getting more and more and more common in our canine athletes for sports medicine as well. So without a doubt, ultrasound is our gold standard.
Absolutely, I agree. We have been using it in our practice a lot, and it makes a huge, huge difference in simply knowing what you're dealing with. And yeah, once we know what we are dealing with, then the next question is always like, how serious it is, and what do we do about it? So, in your experience, what makes, if we take a look at digit sprains, what makes a digit sprain like mild versus serious?
Yeah.
And what should like handlers understand about collateral ligament injuries?
And that's what's so important. We know the digits are the most common of the injuries we see within the area of the paw, right? Or the area of the foot, we would call it. And so, and we know, especially this one, the outside one, number 5, is at least in the literature, the one that's most common. But we don't know if it's grade 1, 2, or 3. And they're not going to talk to us. They didn't show us. If it was a grade 1, they're like, whatever, I'm still competing at a national, international level. Oh, grade 2. Yeah, I'm still competing. I'm 13 out of 10 driving. But then all of a sudden you notice that sensitivity, you notice that swelling, you notice things are changing out there in the ring. And we jump to the ultrasound so that we can say specifically, what grade is it? Is it a grade 1, 2, or 3? Because that's going to help guide us as to what are we going to do from a standpoint of treatment, protection, as far as protecting that space or that joint, and then how are we going to get them back through strengthening conditioning and back to performance. But more importantly, how are we going to keep that from coming back again? I don't want to keep spraining that same digit over and over and over. How can we reach out to you with your incredible mad skills to say, hey, we're going to come up with some techniques to warm this up, to strengthen this area, because there's not a lot of soft tissue around this little digit. So we got to somehow figure out how we're going to strengthen this and get it from not coming back over and over again, for sure. So our idea is we need to know on ultrasound, is it a grade 1, 2, or 3, which is the next steps typically.
How about thinking about like different pathologies? Um, which digit injuries would you say that tend to heal well, and which ones are more like frustrating, and maybe more likely to become chronic?
Yeah. So the ones that are very, very challenging, first off, are the low grades because they're not caught early. So I would say what's challenging is the low grades because they see us, we don't see them, is the way I like to say it. When we get to those grade 2s, those are the ones that are so challenging and most common in people and most common in animals that do sports, whether it's horses or dogs. And it's because they didn't tell us it was a grade 1. They sure didn't tell us it was an early grade 2. We get some fiber breakdown. We get a little bit of micro instability. Mother Nature says, whoa, there's more motion there than there should be. I'm going to lay down some scar tissue. Scar tissue loses that nice elasticity. So it starts to break down further. It's like that cable pulling, and it lays down more scar tissue. Now we've lost range. That area becomes a little bit less functional and a little bit less effective out there in the ring and on course, because we need to grip with those digits. So for me as a clinician, I don't see as many grade 3s. Those are the catastrophic where things just tear East Coast, West Coast. The grade 2s are the ones that plague you and I because they've been going on for a little bit of time. They're the acute on chronic, and they take a lot more work to try to get these guys back to being functional.
I definitely agree. I definitely agree. Um, Now that we're heading more into the treatment options, um, what would be the main treatment paths for digit injuries? Like, is complete rest always the answer?
The word rest drives me crazy. And what does rest mean? The thing that drives me the most crazy is, okay, we want you to leash walk and go in a crate. Oh my Lord. If I hear so commonly people say, well, we were told that we should be in a crate. Oh my Lord, no. That's just going to make these structures weaker. It's going to make us atrophy, lose range of motion, lose muscle mass. And for the sporting dogs that we're working with, up here, we're going to go cognitively cuckoo, right? They have to have a job. They have to stay focused and engaged. And so the worst thing we can do is rest. It's controlled activity. Okay. It's controlled activity, controlled exercise, some rehab things that you're going to do at home and you'll do in the clinic. So the word rest, what are we resting? First off, what are we resting? Do we have a diagnosis? Do we know if it's a grade 1, 2, or 3? And then how is rest going to do anything? Okay. I want to be able to approach it from a standpoint of biology, physiology, exercise, and then exercise performance to get this digit back again. So leash walking, they all have to walk. Them walking doesn't add a lot of biomechanical load to a lot of these structures. I need them as part of the program to start actually engaging and gripping and doing exercises that slowly bring this back. Okay. But the only way we're going to know really about, when to bring them back and how to bring them back is palpation, evaluation, objective assessments, maybe using some things like ultrasound, but even just palpation, manipulation. Is there instability? Is there swelling? Is there sensitivity? And sometimes we have to protect it. Sometimes we have to wrap it. We call it buddy taping, just to add a little bit more sensitivity, kind of a stability, if you would. But remember, I don't want you wrapping it on your own without knowing that you should wrap it. Okay, because wrapping's not a benign thing. Because if you basically tape these two digits, guess what we just did? We loaded other digits. We changed the biomechanical chain here with the rest of what we call the phalanges up to the metacarpals and the wrist. We throw off the entire chain by just taping. Okay, so we want to make sure, why are we taping? How do we tape? When do we tape? I think those things are all important.
How about if we are thinking about different types of injuries? So we have the sprains, we have tendinopathies, we have the fractures. Like, how would you suggest when we need more like protection and more like support versus which ones would be the types of, let's say, injuries that prognostically tend to heal faster?
Yeah, no, it's really good. So you said fracture. The nice thing about a fracture is bone heals back to 100%. Bone is one of the few tissues in the body that if there is a break and you set it, whether you do a pin or a plate or a screw or a cast or just something to get that bone fixated back into position, that bone will be as strong as it was before it was injured. It's the only one of the few very tissues in the body that actually goes back to that. Tendons and ligaments do not. They never, I don't even care if you add regenerative medicine, there's not enough stem cells in the world that is going to take that ligament or tendon back to 100%. It's just not. Your ligament and tendon is what you're born with. And if you injure it, it's never going to be back to where it was before it was pre-injury, okay, no matter what the modality was. So that's why it's so important to have that definitive diagnosis. But from a standpoint, your question, bone is going to heal the best, okay? A joint, that ligament, those can be tricky to heal. The tendinopathies, if you catch them early, they do have an ability to heal as well, but it depends on the grade. We talk about those flat toes. Just because it's a flat toe doesn't mean that you've torn everything. Many times it's just all the supporting structures on the lower side that have stretched out and had some breakdown from mechanical, loading and overload. So it really depends on the tissue, and the grade is so important to answer that question. But, digits, it's small too. Think about how small that little digit is. And yeah, maybe in a Great Dane, it's, the size of our finger or bigger. But I also see agility dogs that are the little papillons. The Papillon borders and all the other things that you're adding to a border collie, and they get smaller and smaller and faster. But those little digits are like little chicken wings. I mean, they're teeny little bones. That means they're teeny little ligaments, and that can be hard to work with. Luckily, most of these do not require surgery. The great thing about most digit injuries is you can identify them early, you can rehab them. Many times the worst case scenario is we're doing some sort of injection and then strengthening and getting them back. It's rare, extremely rare, that I see a digit injury that actually requires surgery.
Now that you mentioned regenerative medicine, and well, somehow we're all so afraid of fractures, but in fact, when we are looking at athletic dogs, I believe that lesion to soft tissue, so injuries to soft tissues, are way more common. So what can we do about it?
Yeah, so when it comes to soft tissues, again, it depends a little bit on the grade. If it is a low-grade sprain, this is something where things like a little bit of therapeutic exercises. We talk about laser therapy. The word is photobiomodulation. That can help with inflammation or the low-grade sprains, even the grade 2s. Shockwave therapy, that's where we use a sound wave to help the tissues with inflammation and healing. You can buddy tape, even just adding some support, some structural support, like to a sprain, that can help as well. When we get to the higher grades, this is something where we still have to protect the tissues, but we may be adding in some sort of, we call it an orthobiologic. This is something that allows the body to help to heal itself. That may be PRP, or what we call platelet-rich plasma. So this is where, if you look at this, for those of you that don't see the image but are listening, what you're seeing right now is a soft tissue structure that has some tears in it, okay? And this would be a grade 2, meaning that we didn't rip the line in half or the tendon or ligament in half. We have these micro tears. And what we're trying to do is prevent these from becoming scar tissue and re-tearing over and over again. So this is where the word regenerative medicine, or what I like to call reparative medicine, allowing the body to help heal itself through the cells that come from the body, really came into play. And this started many, many years ago in horses and humans, and it's really been adopted over the years now into our canine athletes as a way to treat these soft tissue injuries as well. So the whole goal is trying to get these soft tissue structures back to as close to healthy and functional and normal that we possibly can without it just being scar tissue. And that's where your platelet-rich plasma or your things like stem cell therapy come into play.
Okay, how about after this initial period of early inflammation, early phase of healing, then it really comes into the rehab. So absolutely from my side, this is where the rehab and conditioning really becomes important, because once the pain is improving, we still need to rebuild that load tolerance. And the toe really has to learn how to tolerate that movement again, that if you're talking about the canine athlete, sport-specific movement. But before I go deeper into the rehab, from your perspective, Sherman, what has to be true before rehab progression can actually start?
And this is that, I'm so glad you asked that. And this is that gap in our area of medicine nowadays. And this is why the collaboration that you and I have, to me, I'm so blessed to be working with you. Because we have that gap, right? So we have diagnosis. Yes, we know it's a digit. Yes, we know it's a grade 2. Yes, we know we can do some treatment. Luckily, it's most of the time not surgical. It may be something with, some sort of rehab modality, or maybe a biologic we inject. But now we say, when's the time? Where do I pass the baton to you? Okay. And that's the thing for us. I wear my two hats, my surgeon hat, my rehab sports med hat. But as the surgeon hat, we get to a certain point where we're like, okay, we need to pass the baton to people that know how to then take it to the point, that injury, where they can go. And so for us, yes, the swelling's down. The range of motion's improved or normal. There's that sensitivity. We seem to be gaining well. I'm happy with the activity that we're seeing within the digit as we slowly increase. But I need to know also, okay, we may get fancy and do an MSK ultrasound, and here was the pre-treatment and here's after treatment. And yes, those fibers look better. Not everyone has the ability to get to you for your amazing MSK ultrasound skills. So for those, we may just have to palpate, manipulate, and see how we're looking functionally. But if we can re-ultrasound, we saw the fibers before, now we see the fibers after, and we know, wow, this looks really, really good. Let's start to increase that load. And it's tricky. And this is where what you have to do is so, so hard, because you don't have a lot here to work with. Okay. I may say it feels stable. It feels comfortable. Swelling's down. Comfort's there. And I just say, here, yours. And I run away. Because that's the hard part. My part's the easy part. So if you can help me understand, because I love learning, this is why we're all here, is to learn together. Help guide me now through, when I hand you the lead, where do we go? Because we have such little soft tissue here to work with. So not only are we going to try to strengthen it and condition it, what do we do to prevent it from happening again? Because those are things that it's all about, prevention and early identification. But boy, oh boy, I don't want this to come back again. So what are we going to do?
I think this is where the biggest gap is between the injury and then actual performance. Like recovery is not function, not in its term. And I know that this is something that a lot of my colleagues also are struggling with, simply because we cannot say, okay, this is stable now, the inflammation goes down, now you can go gradually back to sport. Like, what does that mean? We cannot just start with jumps and sprints and some play. That's impossible. So we have to backchain everything. First of all, we have to take a look at the bigger picture. So what the dog will do in their normal training week. So is it like a sport that they're active in, like work? How much of the load and demands are happening? What kind of movements the dog will perform? And this will give us the North Star. So where do we want to come? Now, honestly, not all injuries are possible to be rehabbed to the point that we can get the dog back to a full performance like they were before the injury. But many cases we can. And if we have that bigger goal that will help guide us, what steps do we have to make to reach that goal in a certain period of time? Now, the tissues cannot get stronger in a week, that's for sure. Oftentimes not even in a month. But realistically, we're aiming for, let's say, a couple of weeks of progression, maybe 2-3 months of progression, that we can gradually increase the load. So first of all, we have to have control over pain and inflammation. Until the pain is there and inflammation is there, you cannot stress the tissues. That's phase one, absolutely. With some cases, this may go away within a week. In some cases, this might go away within 6 weeks. Depends on the injury. But that's absolutely our starting point. Then, thinking about what is the lowest form of loading? Simply standing, right? So that's our first thing. Before we go into any like dynamic activities, even like low impact activities, first we have to get that weight bearing in a standing dog. And that's where we like to start with just a stable isometrics like cookie shifts, weight shifting exercises, simply just like holding a posture there while we are perhaps guiding the head with a cookie in front of their nose to look left and right, up and down. So this will just like briefly cause the weight distribution in the dog to change. And what this happens is immediately the dog will need to stabilize themselves. And also the toes are working with that. Of course they are. And all of that can help us get through that next level. So once the weight bearing is there and we can see, okay, the dog is okay in the weight bearing, can we walk? Can we walk in a straight line? This is where the walks come in, and we have to start with the leash walking. That's perfect because that's low intensity. It's very controlled, meaning you have the control over the terrain that you're walking your dog. You have the control over the speed of the walking, and also exercises that are kind of like in a straight line come in handy. So think about, oftentimes we will start with just simple stuff like position changes, down to stance, sit to stance. The toes are not really working there, but we start to get the body moving. And some easy cavaletti rails, for example, walking over the poles. These are all low impact coordination before we start layering in any more of the other planes of motion. So when we know that, okay, the straight lines are good, can we get some side forces in? Can we teach a dog to step from one object to another sideways? Can we teach them to walk from one side to another? So this will give us another plane of motion. Then we have to think about, okay, the toe will also have to withstand the rotational forces, like the torque that happens. And this is where we start to layer in some turning work, like walking circles, walking slalom, turning in a circle. These are all like great exercises to gradually begin working the dog through dynamics. But this is all very foundational still. And once this is okay, then we start progressing. If we know that we have to improve the stability in the digit, as soon as the stability is more or less there, we like to take the exercises to unstable surfaces because this is where the toes really start working. We see that they're gripping, we see that they're working. We are affecting also the dog's proprioception. So what that means is simply, in simpler terms, just knowing the position of the joint. And the body has to, so whenever you have an injury, you're always going to damage these proprioceptors. So these are very small receptors that are in many tissues in the body. They're in the joint capsule, they're in the ligaments, they're in the tendons, they're in the fascia. And whenever there is a tissue injured, you always damage these receptors. And what does this bring us is simply the proprioception is a response that actually has to travel all the way to the brain to fire the system. Okay, the joint is loaded in that way. What should I fire to correct that joint position? And this is where we start to bring safety in. So if the dog's proprioception, like body awareness and joint awareness, is not good, what happens if they step into a hole and they don't know how to fire the system to correct that joint immediately, well, we're risking injury, we're risking another sprain. And the more we train this from the digits up, the better the prevention and the better the body will be in handling these stressors in the daily life and later on also in the sport. So now that we have the stable weight bearing, then we have easy dynamics, then we start layering in different planes of motion, then we start layering in more instability work for extra toe work. We have to also think, okay, now we're in a good level, but when will the fun start? When I will be able to start training the dog, right? This is what we want to get to. Everyone does. and yes, when we think about that training, we have to think about the surface the dog will train on. We have to think about reintroduction of sport skill. But before there, we still have to get those explosive work in. This is the time where I want the dog to mimic the behaviors that they're about to do in their sport within a safe and controlled environment of a gym first. So what I do in my work, I break these elements down of the sport and I recreate the little parts. So for example, if we take a look at an agility athlete who is going to weave, like go side to side through the weaves, is there an exercise that mimics this? So I can put the toe in a control load before we get to that agility element. Of course, there are, like sidestepping over a bar with the front feet, like stepping from one object over to another. So those are the behaviors that are similar, even like one foot step downs off to the side. So for all of you who are watching, there is a little visual example, but just imagine the dog does a similar movement, but in a gym environment first. And once we see that, okay, this is good, then we can bring it out and get it under more explosive work. Also, like jumping exercises, if you're talking dogs who are required to jump, plyometrics come in, and of course, turns. Turns are definitely something that affects the digits the most. So when the dog is required to take a turn, what they do is they put their foot down into the ground and they push off of it. So what this happens is this actually puts a big force on the digits. And also, when we came to that phase, we know that the dog is already tolerating that load under lower impact. So now we're safer to bring these elements back into sport. And this is where, like a cherry on the top, we start actually speaking about the sport skills, like jumping exercises, foundations to weaves, foundations of contacts. And yeah, all in that time, we have to also monitor response after the activity, like how the dog adjusts to that, how the dog responds to that. Do we get any sensitivity back? Do we get any swelling back? Most probably not after like the beginning exercises, but how about after more explosive stuff, when we start to introduce recalls and sprints and more play and more dynamics? Like, do we get the swelling back in, or is the toe still stable and feeling okay? And this is, again, back to everyone that is listening, palpate, assess your dogs, feel what is normal for them, because that's something that you will see and you will notice, because you're the one training with your dog and seeing your dog immediately, like after these activities. So yes, Sherman, I was very long on that, but would you agree that the goal is not only that the toe feels better, but that it can tolerate progressive loading without swelling, pain, or compensation?
It is, and that it was so beautifully, described what you just said as far as the return. I think where we run into an issue as well is that everybody wants to get their dog back as soon as possible, right? And we have to remember, we can't speed Mother Nature. The issue with tendons and ligaments, and in this case, we're usually talking about a ligament with these collateral ligament sprains, is that there's not a lot of blood supply there to begin with. All right. So it really takes a while for these things to heal. And so, but we also need some degree of biomechanical load. Okay. If there's not some load on those tissues, the fiber patterns, the way they heal, they just won't. Okay. So that's why sticking them in a crate and shutting, or an X pen and not letting them out and do these exercises in a controlled environment is so important, because if we don't have load, we're not going to strengthen those tissues and give them the guide that we're supposed to have as far as the biomechanical plane with the fiber patterns. So it takes a while for these tissues to heal. So I always break it down into phases where we say, okay, we have to identify the injury, some sort of treatment modality to that injury, whether it's just manual, laser, something that we're going to do, maybe an injection. And then we go into the healing phase. And that's a long period of time, but they don't sit in a crate for that healing phase. But we know for most ligaments and tendons, it's like 90 days for most of these to get back to the point where they at least feel better, look better, function a little better, but they're not ready to go back. And so, yeah, that swelling may go down. The sensitivity may go away. The owners feel, wow, we're good. We're ready to go back. No, you're not. Now we go into your phases. I pass that baton to you. I think if you agree, most of the time now you're looking at another 4 to 6 weeks of just this type of activity that you were just talking about, very regimented. So I usually tell owners, we're 6 months. We're 6 months. And in human athletes, with a lot of ligament injuries, you're 9 months. I don't want to say dogs heal faster. Mother Nature is Mother Nature and biology is biology, but it's a long recovery. And we need to follow these steps so that it doesn't happen again. Okay. And that's the biggest thing. Your point was perfect, that they are doing these exercises at home. Yes, they're checking in with you in person, but at least for me across the pond, mine are all checking in with you virtually. So you're guiding them incredibly through the exercises live even. But then I need them, you can't feel that digit. I can't feel the digit. They're in another state or another country. And I need them to be able to say, oh, wow, you just progressed us. But I've noticed after the last 5 exercises in a row, that it's sensitive again. Whoa, okay, we're not quite there yet. Let's rein back. Let's step back, just maybe to this exercise. Slowly then bring it back again. Because you can't, every digit's going to heal differently. You take 10 border collies, you line them up with the exact same grade 2 to that outside collateral ligament of the 5th digit. And guess what? Every one of them will heal back at its own pace, because Mother Nature is a little different as far as biology, genetics, external factors, internal factors, nutrition, supplements, the way the owner's training, how often they're training, and just the dog and the tolerance to these exercises. And again, they may not even like their digits being touched. This is why early on, you're going to start touching your dog's digits. So patience, 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 patience is something that I tell these owners, which they don't want to hear. None of us want to hear that. But if guided correctly, especially with your program you just described, we can get the majority of these guys back, but not all of them. There's going to be some that is just too far progressed. But I think the way you regiment this is important, but it's not a cookbook. Rehab is not a cookbook. It's not, we're at 4 weeks, we're supposed to do this. We're at 8 weeks, we're supposed to, no, it's dependent on the dog, what you're feeling, what you're seeing, maybe what imaging showing. It's that whole approach that you have to take for each individual patient. It's personalized medicine.
Yeah, now that you mentioned like this cookbook, we sometimes in rehab really feel like we are, chefs. we have the cookbook and we have the ingredients, but you have to make a dish out of it, So, but that's the beauty of it. I believe in what I do and where my passion lies in just being creative and adjusting and adapting this to the dog in front of us. And that's really, really important. Now that we discussed, about the injuries and all that stuff that can go wrong, well, let's talk about prevention and long-term management, because the goal is not to make you afraid of toe injuries, really, really not. The goal is to help you make better decisions. So, Sherman, what can handlers do to reduce the risk of digit injuries?
Wow. And think about our own fingers. There's such little soft tissue around it, right? But it gets back to mechanics, physics. Let's talk about the nail length. Okay, we talked about the nails not being too long. That can cause what we call a biomechanical lever arm and actually cause digit injuries. They do need their nails for gripping, especially dirt, grass, but we want them too long. If we think about training on artificial turf, okay, there's going to be a certain point where if it's too grippy, now when they grip, what's going to happen is they've locked into the surface and it goes up the chain where? To the shoulder. Okay, so we have to really look at surfaces. We have to look at nails. We have to look at different types of things where you identify pads. Is there starting to show some signs of wear and tear, pad burns on certain surfaces? So it sounds silly, but you got to look at where you're actually doing the activities with your dog as part of that prevention. It's very, very important. And that type of activity to what your dog does as far as sport. Okay. The other thing is the body mapping and body awareness. That's part of the prevention, to notice when something starts to go a little awry early on. And then I think from a standpoint of trying to strengthen these, this is where it's going to be so important. When we talk about warm ups, everyone thinks about warming up the shoulder. They hear my name and they're like, I don't want to see Canapp. It's going to be a shoulder. Oh my Lord. And oh my Lord, all she talks about is the iliopsoas. Well, yeah, if it's a performance dog, they turn at speed, they're going to eventually have some shoulder stuff, and they're eventually going to have some psoas stuff because it's a hip flexor. But it starts down the chain at the digits. Okay. And we don't give enough love to warming up the digits. So, what I'd love for you to do, if you don't mind, explain to those watching or listening, what can they do? Because I'm a big fan of warm-ups, right? We're just not going to get out and run cold. Ideally, sometimes you have to, but I'd love for these digits to warm up. What can people do to warm up these digits?
Yeah, I mean, warm-ups and cool downs for me are really like the alpha and omega of every dog training, every dog activity. So the beginning and the end. And if you're talking about the toes and warming them up, if a dog is about to do all these turns and deceleration and acceleration and maybe landing and braking within their activity that they're about to do, well, just warming them up with taking them out for a potty break, this is not going to be sufficient. So we have to, again, have that image of the activity in front of us. So what is the dog required to do? And again, if we're talking about the sports that require a lot of intense movements and behaviors, well, for sure, we have to also prepare the toes. So, okay, yes, the general warm-up should always start with a little rock. So take your dog out for a walk, get them to potty, start working their cardiovascular system to warm up the large muscle groups. But to specifically warm up the toes, for sure, you can pay a little bit more attention to that. So we know that we have the opportunity for dogs that are okay with tolerating our touches, also in a competitive or training environment. You can just like gently grasp the paw in your hand and just like gently rub on the surface and increase the blood circulation in the area. Then there might be certain conditions that could benefit from just some extra little passive range of motion that you can do. Just extend, flex the toes. But this is something that you do like dynamically. You're not going to go there and really like press the fingers together, hold them in place. It's basically as if you would just like be warming up your wrists or your ankles. But the most important part that lies within the warm-up is actually an active dynamic warm-up. So think about exercises that you can do to guide your dog through different planes of motion, to different movements, like walking backwards, walking sideways, circling, figure 8 between your legs. This is a fantastic exercise that will also prepare the toes for all the turning. So this can be like easy task, whatever your dog likes and knows how to perform. It can definitely do good for the dynamic warm-up that you can do. And then, of course, if your dog is about to participate in an explosive work, you might also throw in some recalls, maybe some easy jumps to get them ready for that. But basically, just think about moving in different directions and then going from lower intensity exercises all the way up to more explosive work. And this is something that doesn't take you like an hour of time. I mean, once you know your routine and your dog knows your routine, you can do it in 10-15 minutes of just like throwing the exercise in as you're taking your dog out for a walk and preparing yourself also for the activity. So definitely that's something that everyone should do, and we encourage you to do because it's easy and there is no excuse not to do it.
No, and you made an awesome point. Warm up, warm up, warm up. And when you said the stretching, you said active. Okay, too many times, and we'll talk about active and passive stretching in another episode, and warm up and cool downs for sure. But we don't want that passive initially. Okay.
Absolutely.
We know we decrease bursting strength. We can actually cause microfiber tears. There's so much, and that's not just shoulders and psoases, which we talk about a lot. It's all the way down to the digits. Okay. So it's going to be active involvement is what we're going to be talking about.
Yeah.
And then afterwards, you get done your run, you get done training, you get done your hike. That's where you do your passives. And that's where, remember, get into a consistent rhythm. I'm okay if you start high and work your way down to the toes. I typically start at the toes just so I'm systematic, and then I work my way up. Okay. So it could be you're done with that hike, you're done with that trial, you're done with whatever it is you're doing activity wise with the dog that day. And now you're going to start at that toe, and then you can do that passive range of motion for each digit. Because remember, you're mapping. You're feeling, did anything occur today? Is anything off? Okay, you can hold that little bit of a stretch now. Now we can do that passive stretch to each one of these guys because you're going to work up the chain. Because remember, it's a chain. And while you're rehabbing that digit, that one little digit here, it's throwing off the entire chain, and there's going to be compensatory issues that they're loading the opposite leg. Okay. So they're loading, back to the right hind. If it's the left forelimb, that right hind's taking extra load as well. So think of the whole body, but that active and passive stretching is so, so important. But I want to make sure that as you're mapping your dog, you're cooling down, and then you're doing your passive stretches. Document. Okay. Document, data's king. So these little digits, they don't seem important, but they make a huge difference. They can make a massive difference when it comes to injury prevention and when it comes to overall performance.
Yep. And there is also another layer that we did not touch as much yet. And yes, you can actually condition your dog's toes. You actually can. Although that there are not like a lot of soft tissue around that you can actively strengthen, we actually can strengthen the ligament, and we can work on proprioception. So I mentioned that this is the body's ability to sense in which position the joint is, and the sooner the body recognizes, the more it can fire the system, co-contract other muscles to stabilize the joint in place and prevent it from going out of place and cause what we call a sprain. So one of the things that you can absolutely do for your dog's toe strength, just think about anything that involves some sort of a gripping. For example, also digging. Digging can be a wonderful exercise that you can do with your dog. If they're allowed to dig holes outside, good. Otherwise, you can just simply teach them maybe to dig into the carpet or into a towel. So that's a fun exercise that you can play around and teach your dog, and they will actively grab and dig and also strengthen their entire forelimb chain. Then all the exercises that require some sort of a stabilization, so you can do it on a stable surface, but it becomes even more effective if you take it to the unstable surfaces. So ligament strength and joint stability, this is something that can really get improved with the use of inflatables, of unstable equipment. Now, I'm sure that one of the episodes ahead is going to be dedicated about stability and instability, because I think this is like such a broad and important topic. But just for today and for the digits in particular, I will say that I would pick unstable equipment over the stable ones, simply because it requires the toes to work to a much bigger degree. And whenever we are talking about training and conditioning, don't forget about resting part or recovery periods, so that you also give time to the body to rest sufficiently. And by resting, we don't mean like laying on the couch and doing nothing, but actually it's active rest. So take your dogs out for a normal daily walk. Just give them a break from, let's say, high intensity training. And yeah, Sherman, would you like to add anything to that?
No, I think it's all about enjoyment. Bonding with your dog is part of that body mapping and early identification. So again, today, to those watching or listening, go get your dog, sit down and map out just the digits. Okay. Get some pictures, get some videos, start to feel, wiggle, flex inside and outside each one of these little digits. You notice anything, map it. Okay. I think that's the biggest thing is prevention. When you get done those exercises, how do they feel? Okay. So it's a good way to bond with your dog, but it's also an important way to map so that we know if something's going on in the future. So that's my takeaway would be the digits. We don't give them enough credit, but it all begins here.
Yep. And my takeaway, if nothing else from this episode, I want you to start thinking about digits as an active part of your dog's body, and not something that is there left unnoticed, because it's the first contact with the ground, and it absolutely affects the entire body. So take proactively the steps with the warm-ups, with assessments, with safety precautions in terms of what surface you're choosing, with conditioning, and yeah, if there is something going on, early intervention is what makes the real difference for canine athlete, and I think we can extrapolate this to any injury out there.
Yeah, and hopefully this was helpful. And if you have questions, again, we're here to learn as a group. We can learn as much from you as we hopefully are giving you. So put them in the chat. Okay, so go ahead and make comments. So if you have a question, there's many others out there that may be asking the same question. There are no bad questions. So we can learn together as a group, as a organization. It's all about taking care of our canine athletes. So please don't be shy. And if there's a question, let's hear it from you.
See you next time.
Bye-bye. Thank you.